So she needs to do her prep like on, like if we're doing a colonoscopy on a Friday,
No, we're
she
doing it on Tuesday.
on a Tuesday. Okay, so then she needs to do a prep on like Wednesday, get herself cleaned out, and
The
then
day before.
do one on Monday, and she
Okay.
should be good. Oh yeah, chronic constipation in a lady with who needs a colonoscopy. You have to prep them about a week ahead of time once, and then do it again right before surgery. But anyway, that's not what we're talking about today. So I had a lady that, actually a gentleman that came in with an umbilical hernia, as well as some colon surgery. So we fixed his colon, took it out. I'll show you a little bit of that. But he also had an umbilical hernia, so we ended up having to fix that as well. This is really just about how to use a staple gun. It's not the same staple gun that you use for putting papers together on your desk, but it kind of works the same way, sort of. It really brings tissue together. But that's what this video is about. Take a look at it, see how you like it. So we're closing this with staples, and my assistant is puts one in to guide it. And the reason she did that is because I cut the belly button out. The main reason I did that was he had a belly button hernia. There you go. So what you do is you reapproximate the skin edges like that, so it's dermal to dermal, and you just fire the stapler. That one's a little crooked, so we have to take that one out. Yeah, I'll do it like that. So you can
You don't
see.
have to push down, you just hold
No,
it.
yeah, you don't have to. Yeah, you literally just click. No, go back where you were.
Mm-hmm.
Yeah, just do it like that. You just click it. And that's it. Keep going. See how easy that is?
Yeah.
There's no pressure in it. It's just the hard part is actually her getting that skin reapproximated like it needs to be. And then up here, same thing. His looks a little jagged because of his belly button hernia. And this will flatten out over time. It just takes a little bit. And just put one more in. Yeah, it looks good. And that's it. All right, so that's how you use a staple device. They use them in the emergency room all the time. We try not to use them on the head because hair grows over them and they're hard to get out. Try not to use them on kids because they're painful and hard to take out. But usually they work pretty well. I like to remove my staples at day 7 and day 14. You can remove them as early as day 5 if you put like a Steri-Strip over it. You don't have to leave them in for 2 weeks. That's a little bit long. If you do that, you'll get what's called railroading. So you'll see where they have an incision and then they have these little dots along the side. That's usually from staples that are left in for 2 to 3 weeks. If you're diabetic or something like that, you sometimes need to leave them in a little bit longer, or if you smoke, that's usually the biggest reason. But for the most part, you can take them out, and if the wound's going to fall apart because it's infected or something like that, it's going to fall apart regardless, and leaving those staples in for a long time to give somebody an ugly incision doesn't work. Yeah, staples, that's it. Thanks. Oh yeah, like and subscribe, all that nonsense.